Okay. Gingy loves this. So the FHO surgery is so barbaric and drastic and took so much out of Gingy that I try and give him like a 10-minute massage every day along the spine, especially on the lower back here, because what else can we do? You know, we're not vets, but the control we do have is to feed them properly, you know, use alternative medicine. I'm using probiotics and fish oils at the moment on Gingy. I'm giving him massages. I'm trying to take him outside to get him to exercise for the rehabilitation of FHO, but it's not going very well. He's not very active and he's not walking much. I pick him up and take him to the backyard, and he has to make his way back inside the house then, and that forces him to walk. So I do that like twice a day. But I'm not sure if it's enough. And we're at the 4-week post FHO, and he can't go into a trot. What I mean is he can't go from a walk to a run. Okay, Gingy, come on. Without the right leg, the right hind leg, the FHO leg, going into an arc, like arcing to the right, and he can't put any pressure on it at all. So he's basically running with 3 legs, and just basically the FHO leg is collapsing from under him when he tries to run. Now I know there's supposed to be a false joint formed, but there's practically no false joint there. There's no false joint there at 4 weeks post-op for Gingy, and it really distresses me as his owner to see him like that. So he really loves his massage. So at least this is something that he looks forward to. And if I stop, sometimes he'll put his right paw on me and you know, telling me he wants more massage. So he does enjoy it. I don't always use this tool. I use my hands as well to massage him. By the way, where did I get this from? I got it at Bunnings, but I bought it online at Bunnings. It was about $40, $48 maybe. You like that, Gingy, eh? Yeah, nice boy. Nice boy, Gingy. So I'll just, yeah, Gingy, see that? I'll just move this over a bit. Go there, Gingy, good boy. So you can see a little bit better. Yeah, big boy. So after 10 minutes, this tool will automatically shut down. Now he's trying to play with me. Gingy. Yeah. Okay. But that's what I want to see. I want to know that he's happy. So yeah, he's in a bit of a good mood now. So massage gives him pleasure, you know, and it puts him into a good mood. And when I massage him, he licks me. He kind of repays the favour back. So, hey, darling. Oh, no, I think he wants to play now. He wants to play a bit rough. Hey. Good boy, hey? In a bit of a mood now, hey? Yeah, you're in a bit of a mood. Yeah, hey, you're in a bit of a mood, Gingy, hey? Bit of a playful mood, hey? Oh. Good boy, hey? Yeah. Hey, good boy. Come on. Good boy, eh? Good boy, eh? Good boy. Yeah. Clear up some of the environment here. It's so messy. Good boy. So I'm usually massaging him with two hands, but I've got to hold the camera with the other. I've got no one to help me with it. When I do this long enough, it actually sedates him and he goes to sleep afterwards. So I'm using my thumbs here, and by the way, I am a masseur. I'm a masseur, a massage therapist and a naturopath, and I've been massaging for about 30 years now. So I'm using my thumb along the vertebrae. Yeah, Gingy, nice. Nice boy. Nice Gingy. Nice Gingy. Hey, nice Gingy. Hey, nice Ginger. Hey, nice Ginger. Nice Ginger. Yeah, Ginger. He's laying on his right side, and it's the right hind leg that they did the FHO on. I've been looking up a lot of research on total hip replacements, and they say it's over 90% successful. And one resource said, mostly on Google, it said that if they aren't a candidate for total hip replacement, FHO is the next option, which doesn't provide long-term stability. So they basically downplayed it. And so obviously Google reads websites, so it was AI Google, and they said that although they never returned to a full function, that was, I don't like reading that, but it's a reality. And you can see Gingy's legs, his right leg is basically still like jelly and collapsing from under him as soon as he tries to run at 4 weeks. I'm considering a total hip replacement for him. If he cannot run fully and run properly, and he doesn't have his, if he doesn't get his life back where he can fully function, I'm considering it. But I'm considering the consequences too. Sometimes there are basically in the first few weeks, they've got to be confined for 6 to 8 weeks, strict confinement after total hip replacement. And it's within the first few weeks, if they aren't confined enough and if they're using their legs too much, it can actually re-dislocate. The actual part that they use, the prosthesis can dislocate, and then they have to go in again. And also sometimes the parts can loosen, and then they have to go in and do more surgery. There can be also infection. Infection is something like a 0.8%. It's very low, but it's drastic. It's a catastrophe, because it means they have to go in and remove the entire transplant if there's an infection. So it does come with risks, but they're minimal. They're about the risks are like 10%. So I have to weigh that up for Gingy. Some people are happy with FHO. I know what they do. I know what it involves, and I did not want this for him. And I wanted my cat back to full function, and that's not going to happen. Good boy, Gingy. See, Gingy can take this for ages. Yeah. He's a good massage patient, aren't you, Gingy, eh? Yeah, good boy. Yeah, good boy. Sorry, Gingy. Okay, good boy. Just a funny thing about Gingy, when he's at the vets, they call him grumpy, feisty. He actually attacks the staff members. He's scared. He's just scared. But with us, he's very affectionate, as you can see. He's a real love bug, a real smoocher. But when he's at the vets, you see, he thinks they're going to kill him, and he's basically fighting for his life. He's very worried. And it's also associating vets to pain. So he had his eye removed. He came to us as a stray in 2019, and we were feeding him, and one day he turned up with his eye bulged out and a massive abscess on his head. And we saved him. We took him to the vet, and he had to have the eye removed and a drain put on his head to drain the massive abscess, and they neutered him at the same time. So 3 things in one surgery, 3 procedures in one surgery. And he was there for a week, and every day they had to sedate him a little bit to change the dressings. And he was a stray then, by the way, so he wasn't really, we weren't able to really pat him, and he'd hiss at us. But after 7 days, he started smooching the staff members. He basically tamed. He became tame. And when we got him back, I kept him confined in the kitchen. So I guess he got his dose of pain, or associated. They're basically associating pain to vets, and you know, you walk in, you can smell it. All the medicines they have. A cat knows what it is, and as soon as they go into a cat cage, they know where they're going. Good boy, Gingy. Good boy. A beautiful boy. You can see how much I love Gingy. So look, I'm devastated by this FHO and the fact that his right hind leg is still collapsing from under him. I'm absolutely devastated. I'm very angry as well that we didn't get to do the toggle anchor, which we would have went for, which could have saved all of this. Good boy. So those who don't know, basically, I accidentally ran over him. You know, so the guilt that I've gone through is it's pretty horrendous. But you know, I didn't kill him. You know, he's still here with us. But he did dislocate his hip, and they did a closed reduction. Then they followed up with X-rays about 10 hours later, and they said it's still holding, but 50 to 60% of closed reductions don't work, and they failed to insist that we have follow-up images days later, and most likely that's when it re-dislocated. So they told us to take him home and confine him after the closed reduction for 4 weeks. Well, during that 4 weeks, it had re-dislocated, and by 4 weeks they can't do the toggle anchor. And a veterinary surgeon at another clinic tried to. He said as soon as he goes in and operates, when he opens the hip up and sees it, he'll know whether he can do it or not. He'll ring me up at that stage while Gingy is still under anaesthetic. And he rang me up with the bad news. Sorry, it's eroded too much. It's 30% eroded, scar tissue, and a toggle anchor won't work. And he wanted my permission to go ahead with FHO, and I did not want to give him permission, but I had no choice. So we're kind of left in that position. We're put into that position. So these incompetent vets at the start, they didn't insist on follow-up X-rays and so many things. After 7 days, he had to have the buprenorphine patch taken off his leg because he had a buprenorphine patch for pain, and they had to sedate him for that. They sedated him for that, and we said, well, whilst you're sedated, take some X-rays so we can see what's happening with that hip. Well, I found out those X-rays never went ahead, despite the fact we asked for them. 3 days later, 10 days after the injury. I took him back. I was extremely concerned that he's still limping. And the vet didn't even take him out of the carrier to examine his hip and touch it. You can feel a hip and you'll know if it's out. She didn't even get him out to examine him. She relied on a video I took of him walking. Very unprofessional. So basically, the FHO was forced on us through these incompetent vets. We went to a more experienced vet who did the surgery. I do blame myself for not immediately getting him to an orthopedic specialist after it happened. But I thought we were getting the right advice at the time. But obviously we were not. I think Gingy might have had enough. Good boy. Okay. Good boy. What are you going to do now, Gingy, hey? Yeah? Yeah, you're going to get something to eat? Going to have some milk? Have some milk? Yeah. No? No milk? Okay, good boy. Have a good scratch. Good boy. Good boy. Yeah. See, he's on his left side now and his right side is exposed. I can feel the hip raised up. It's almost projecting out of the skin because there's no ball and socket there to hold it in place. It's floating in space, basically. It's terrible. This is how it was when he was dislocated. Like 2 weeks after the closed reduction, which is when they try and pop it back into place despite the fact that it fails 50% of the time. 2 weeks after that, I started feeling this bony prominence there. So obviously that was the greater trochanter, the top part of the femur. But I can feel that even worse now after this surgery, because it hasn't been popped back into the joint. The head of the femur has been cut off. See how he's actually licking me now? He's paying back the favour. Yeah. Good boy, Gingy, hey? Okay. Yeah, that's very disturbing for me. I don't like to know that it's actually sticking out of it, almost sticking out from his skin, his hip bone. The other one isn't. Anatomically, it should not be like that. And that's not going to be repaired. That's going to stay that way because it's pointing upward. So, okay, and so when he walks on it, that's why the right leg is now shorter than the other three. And that's what happens with FHO. It's one of the reasons why they have a permanent bunny hop. So they're permanently altered. And I really disagree with these vets who push FHO surgery and really sugarcoat it. And they don't really tell you they have a permanent altered gait. And that altered gait can lead to it does lead to osteoarthritis in the future. Because the other limbs have an extra load to bear. I mean, his left hind leg, has to bear most of the weight now, and so does his front legs. And the fact that his spine his pelvis, the fact that his pelvis is now tilted. The right is tilted, his hip is tilted, the right is raised. His lumbar spine, his lower back is twisted now as well. He's deformed. You can't see that, but that's what happens. Obviously, he's going to have lower back pain in the future, and it's one of the reasons why I've got him on fish oils now to try and help with the inflammation. It's going to come. It's going to come. All FHO cats are going to get osteoarthritis and pain from the altered mechanics and the permanently altered gait. And we'll also raise the fact that, that there's a decreased range of motion with that leg, and you're supposed to be actually grabbing and moving it back and forth, but you can't do that with a cat. That's part of the rehab. You can't do that with the cat. I couldn't do it with Gingy. He'd scratch me to death. And also stiffness is another big... Well, it happens, basically. So they're basically functioning after FHO, but they're disabled. And how can you tell if it's stiff? Well, I can tell. That bunny hop shows that he's got some stiffness there when he goes into that bunny hop, when he tries to run. Okay, thanks for listening to me basically ramble on. Say goodbye, Gingy. Goodbye.